I will say that the aspergillus is the biggest culprit, and that's the one I was afflicted with as well. They have other mechanisms in the body besides oxalates. They can really damage your body. They're very, very, I mean, they're a poison.
Let's ditch the quick fix and dive into today's conversation.
Welcome, everybody. My guest today is Dr. Mandy LaGreca. Dr. Mandy is the Bladder Pain Coach. She is a health educator that specializes in investigating the root cause of ailments. She uses cutting-edge science to help her clients reach optimal health using the mind, body, and heart. Dr. Mandy is recognized across the world as one of the leading experts in interstitial cystitis and painful bladder syndrome. She has dedicated her life to helping people find relief and remission from interstitial cystitis and painful bladder syndrome. Welcome, Dr. Mandy. It's good to have you here again. It was about a year ago we had a first conversation on painful bladder syndrome, and we're going to dig into oxalates today more specifically, but why don't we do a little bit of a review? Give us a little bit of review of what painful bladder syndrome is and interstitial cystitis, and how you've got to where you are today.
Well, painful bladder syndrome it involves various different symptoms, not always isolated to the bladder. It can be urethral, it can be pelvic pain, it could be vulvodynia, oftentimes coincides with gut dysfunction as well. So many of the patients also have IBS or some type of chronic diarrhea, chronic constipation. So it is a whole body system. I'm starting to appreciate this for being more of a whole body disorder, but it happens to be that the bladder is the crying baby. And the reason I think that's the case as well, the pain is tremendous, unbearable. It does disrupt your sleep because you're getting up in the middle of the night to go to the bathroom all the time. It can affect your social life because foods can cause flares. There's some foods, you can't eat certain foods, alcohol, for example. And honestly, could you imagine like being in a movie theater or in an airplane or on a bus and have to constantly use the bathroom? It's very disruptive. It's, I believe it's one of the top conditions that has a very high suicide rate, unfortunately. It's extremely, extremely debilitating. And I was afflicted with it. I was diagnosed, now we're looking at 14 years ago. Same, story as all of my patients. You go to the doctor, they identify, you can either have testing done like a cystoscopy, or they just use a survey. So with me, it was a survey of symptoms, checking it off. If you got a certain percentage of them checked off, you're given this diagnosis and a medication to go home with. And for me at that time, it was Elmeron was what they wanted to prescribe me. I know they use other medications now. I'm not up to all of that any longer. They don't work. They're very ineffective. And when I was told that I was going to have this for the rest of my life, and by the way, you're going to lose a lot of your hair on your head, I said, oh no, that's not a good solution for me. So I kind of went off and, here's my story. I had to navigate my own way, went to school, put myself back to school, got my doctorate in clinical nutrition, and made it, interesting for my story as I hadn't intended on being a bladder pain coach. At the time I started my career, I was actually working with weight loss patients. But it just happened that I could think this was my calling. People needed my help, and this is where I'm at. And I love what I do.
Yeah, and life's experience is invaluable to be able to relate to your patients and understand what's really happening. So you kind of touched on there's a few things that kind of impact the general health overall, and it's not just the bladder, but it's the bowel, it's the the kidneys, the whole inner system. But what are some of the big problems or exposures or causes for the dysfunction, the dysbiosis of the gut, of the whole system, really?
That is a really good question. Modern lifestyle.
Okay.
Yeah, modern lifestyle. It's funny, we live longer, right? But we're not living the quality of life despite the fact that we're increasing our life expectancy. Although I did learn recently that we have decreased our life expectancy by about 4 years recently. So I think the life expectancy is coming back down, but we have increased it. And I think that's because of the advent of, technology and medications. So the invention of antibiotics was a good one. I believe when, penicillin was invented or founded, it was for a good reason. But I think the pendulum went too far. And when I was a child, I go to a doctor, I have a cold, which is viral, which we know not to give antibiotics now. Well, they prescribed it back then. So I
Right.
think, overuse of antibiotics, but I could take it even further. I mean, a lot of births are born C-section versus, natural childbirth. And, now we know that we have the vaginal microbiome seeds the baby
Right.
early on. So there's that. And then there's formula feeding. I was a formula fed baby. They used to discourage breastfeeding when I was a baby. Now we're encouraging it again. But back, during those days, they were discouraging it. So the gut is leaky as an infant. So whatever you introduce when they're that young, 1 to 6 months old, can actually cause inflammation and start that leaky gut. So I think that's what we're seeing. And then on top of it, let's look at, we could take it further: pesticides, herbicides, poor food quality, and poor food choices. People are not being educated on what to eat and how to eat. So there's a lot of junk food. I mean, look at how teenagers eat now. It's terrible. It's just, it's horrific. And then on top of that, we have now another layer to add, which is fairly modern, is mold exposure. And I think a
Right.
lot of that's coming from these homes and how they're being built and the building material. And I'm seeing more and more and more people in my clinic that have overgrowth of mold. So.
Yeah. So yeah, boy, you're hitting on the a good bit of what's going on, the modern lifestyle, all the exposures. And right, there was a certain amount of positive about the introduction of penicillin in a situation that was kind of out of control. But we've forgotten that, we just want to use those things when we've not been able to keep things in control, not make it the control,
Right.
And so that's one of them. And like you said, all the different toxic exposures that are going on. But we're going to talk about oxalates today, and it's kind of an interesting thing because that's more of the whole food sources that we usually typically recommend, from a natural perspective, right?
Yeah.
So it's got an interesting dynamic as we get into this conversation. So oxalates appear to be a big factor for digestive problems, skin problems, and others, right?
Yeah.
So share a little bit about oxalates and how it's impacting our health and the foods. Let's maybe just go right into the primary foods that are the biggest concern.
If you've listened to this podcast, you know how often ozone therapy comes up. I personally have the Simply O3 Complete Kit and use it as a preventative measure or when I come down with something. So whether it's ozone therapy at home or in your clinic, Simply O3 has equipment for your needs. If you are healing chronic illness or biohacking for optimal health, Simply O3 will make getting started with ozone therapy super easy. Go to simplyo3.com or call 844-655-2524. Use code FIX to get 10% off. That's www.simplyo as in oxygen 3.com.
So they're basically naturally found in plant-based foods primarily. Now, one thing I think a lot of people neglect to also mention is they are part of the microbiome of certain microbes as well.
Mm-hmm.
But primarily when you think of oxalates and you Google it, or if you listen to any oxalate expert, they're really focusing on the plant-based food. So what are we talking about here? Swiss chard, spinach, sweet potatoes, all nuts. Not all seeds, but almost all nuts, I think, except macadamia, but most nuts and seeds. Certain vegetables, you just have to know that there's some that are lower and some that are higher. And then even within the foods that are high, it's variable depending on how it's grown, depending on how much oxalate is produced. So, but we know the ones I just listed are the highest.
Okay.
Chocolate, black tea, I'm trying to think, beets.
Now, is it beets and beet greens, or is it just beet greens?
My understanding is primarily the red beets.
The actually red beet. Okay.
Yes, that's my understanding.
Okay. Yeah.
Not like kale is listed as high, but not all forms of kale, right? So lacinato kale, which is your dinosaur kale, is actually low oxalate. And then it's dose dependent. So what gets really confusing for a lot of people who read about oxalates, and you get like multiple different food lists.
Right.
One will say high, one will say low. And even the spreadsheet from the Triangle Oxalate group, even their spreadsheet can be confusing. You have to look at the dose because it does depend on dose. It's dose dependent. So like half a cup versus 2 cups, if you look at a spreadsheet, one will say high, one will say low. It can be very confusing to the consumer. But the ones I just mentioned are, especially spinach, especially Swiss chard, they're so high that you can't even have a small amount. But everything else is up for debate, depending on how much you're eating and how you're preparing it. So that's where I stand with oxalates. Just so you know, I am not a carnivore eater. I'm not a carnivore promoter. I don't
Okay.
believe in that diet. I think a lot of people do, and that's great if it works for them, because diet is personalized. I truly believe diet is personalized.
I think
Each
it's a
person
good point.
has, yeah, that's the thing. And so I personally don't believe in carnivore for my body. I don't necessarily think most people, I think we're omnivores, right? So we're supposed to eat a variety of foods. So
Yeah. 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 I like that. I think that at the base, you get down into the conversation of quality, whether it's a plant-based or an animal-based food source, you got to really try to get it as organic as possible and as close to, I believe, the way God designed things, is the way I look at it. But then within that, yeah, there's the detail, like you're saying, you're kind of fleshing out some of the detail. For some of these, it's dose dependent. For some of these, we're still trying to learn exactly what it is. Another question that, that I've still not totally answered in my mind is, it appears to me that if you cook some of these things, it does make them more digestive tract friendly. Is that what you're finding as
my
well?
understanding is boiling some of the foods and dumping out the water can reduce the oxalates by up to 30%, but I don't think it's more than that. And there's just still some foods that are still, you're never going to achieve a low enough where it's safe. So the amount that's safe is variable per who you're talking to. I mean, I think if you go to like the triangle oxalate group, they're saying 50, I think it's 50 milligrams or grams, 50 is the number. And then I believe that it varies between 50 and 150. The problem is something like spinach has thousands of milligrams of oxalates.
Yeah.
So that's the thing, is you're dealing with some foods are just, no matter how you cook it, you just can't get away and get it down. But like broccoli is a perfect example of something you can cook, boil, dump out the water, and and that's how I eat it. So when I make broccoli now, I boil it and dump it out. And then I just do add about no more than a cup of cooked broccoli at a time.
Gotcha. Yeah, because it's such a good source of calcium. There's some good positives about broccoli. What about steaming or roasting? Kind of hang into this cooking part of the conversation for a minute.
I don't think it makes the difference. My understanding is when you boil it, the oxalates kind of go into the water and then you can dump it out. And that's why they recommend, if you're actually putting them in a soup, if you drink the water, and this has actually happened to me, if you drink the water, you're actually going to get a lot of the oxalates in that soup.
Yeah, so you're not going to break down the oxalates chemically wise with steaming it or roasting it. It's basically, you just got to get rid of it by boiling it out of the plant.
That's what I've understood. Yes.
Okay. Yeah.
And I'm by no means am I like the oxalate expert, like, some of these, like Sally Norton, I think that's all she does for a living. So by no means am I, that's all, I see a variety of different things, but currently my understanding about how to prepare it to make it safer is to boil it, dump out the water. However, again, there's still just some foods that you just can't do that with. Like I said, spinach, just some of them, they're just too high. It's also interesting because like potatoes, the new potatoes, I think they're the small red ones, are safe enough that if you boil and dump out the water, you can actually consume those.
Okay.
It's very interesting. Like I just mentioned, the lacinato kale versus regular kale. It also depends on the breed and the type of fruit or vegetable you're dealing with. So,
sure.
How ripe it is.
Okay.
Ripeness also, like for example, I know with bananas, when it's more on the yellow green side, the oxalate content is higher. Once it ripens, it's lower, but then you have another added layer we're not going to talk about today, but then there increases in histamine.
Right.
Which many of these people have histamine issues as well.
Right.
Who have oxalate problems. So I have to, the conversation with each person has to be, well, how ripe is it? How non-ripe is it? And then also, how do you cook it?
Right. And it goes back to what you said right at the start. It's really, you got to personalize it to each particular patient that you work with. Because they all, like you said, they all have their different, needs. What are some of the conditions that are really related to what they're finding oxalate, the impact of oxalate? What are some of the conditions that are related to oxalates?
A lot. Anything that is inflammatory. and even autoimmune.
Hmm.
First, understand what they do. Like, so we know the leaky gut. We've had enough conversations about leaky gut to understand that when you have a leaky gut, you're introducing the potential for inflammation. And so now when we think of inflammatory diseases, there's hundreds of them, right? So, but root of the cause of the problem with the oxalates is the promotion of the inflammasome activation, which then opens the door for all diseases that are inflammatory driven. So that's number one. The other problem with oxalates, because they are mineral chelators, they're anti-nutrients. So they do bind up minerals and make them unavailable. So now you're having to deal with nutrient deficiencies as a result of having these in your diet in high levels. And then the last piece of it is that because of that NLRP3 inflammasome, as well as just the nature of how oxalates are inflammatory, now you have oxidative stress. And so the oxidative stress, you're going to deplete some of the vitamins that are in your antioxidant pathways. One big critical one is vitamin B6, magnesium. They're used up when you're, trying to get your body's trying to churn out glutathione. And if it's just using all your glutathione up to deal with oxidative stress, now you're going to have mineral and vitamin depletion. So now you have leaky gut, you have mineral depletions, vitamin depletions. What can go wrong? So some of these conditions, I can just list some of the common ones. Okay.
Yes.
Everyone knows kidney stones, right?
Sure.
We know about kidney stones. And if you talk to a urologist, they're going to tell you the oxalates are only going to cause kidney stones, and that's it. But that's not true. We've got other issues. We've got chronic UTI. We've got obviously interstitial cystitis, vulvodynia, cataracts, breast cancer. There's actually been reports of oxalate crystals in patients with breast cancer in the breast tissue. Pulmonary fibrosis, you can look that up. It's in the literature. It's quite frightening, but there is a link to that. Fibromyalgia, endometriosis, osteoporosis, vertigo, diverticulitis, PCOS, uterine fibroids, and cardiovascular disease, diabetes. I mean, it's
quite a list.
Yeah.
Quite a list. And adrenal fatigue as well. What's happening in the adrenal glands because of oxalates?
Well, the adrenal gland, okay, so I want to rephrase that word. I remember when I did the FDN training, they taught us that there's no such thing as adrenal fatigue, actually.
Okay.
Reed Davis told us that it's actually called adrenal dysfunction.
Okay.
So
fair enough.
And the main reason for that is adrenal fatigue implies that the adrenals are like tired, they're overworked, but in reality, they've become dysfunctional. And they're just not producing the cortisol production from your adrenal glands becomes wonky. So
Okay.
in some cases, generally with this adrenal dysfunction, you have most people have low cortisol. It's like totally bottomed out. So I do believe the reason oxalates contribute to adrenal dysfunction is, first of all, I mentioned that they bind up your minerals.
Right.
So you need like minerals for your cells to function, right? Like zinc, iron, cobalt, sodium, potassium. So that's for your cells to function. You need minerals.
Rebuilding and repairing, yes.
Correct. They also bind up heavy metals, which can be trapped in your tissues. And now you've got heavy metal toxicity, which can also then lead to oxidative stress. They can totally shred your mitochondria. That's another one I think is really important to understand. They can physically shred it, and they can also inhibit glycolysis. And now you've got more oxidative stress to deal with. Remember, they are nanoparticles, and they do physically hurt tissues.
Okay.
They compete with sulfate, so via sulfate transporters. And that can also lead to depletion of your antioxidants and detoxification pathways. And so more overworking of your cellular processes in the body. And then they can form crystals in any organ. So thyroid is one organ that's very susceptible to these crystals.
Okay.
I would believe adrenal glands are as well, but I know particularly thyroid is. And a lot of people who think they have adrenal fatigue actually have hypothyroidism. And that can cause you to feel very fatigued as well.
Okay. Is there, kind of a silly question, but I got to ask it. Is there anything good about oxalates that you've come across? Is there any positives that have been found with oxalates? I haven't seen anything yet, but I'm kind of, it's in the food, is there any positive to it?
The positive is the plants are protecting themselves from being eaten. That's
kind of that it's a plant-based positive. Okay.
Yeah. So, I don't think there's anything positive, but I do believe that we were born we were naturally supposed to be able to degrade them in the quantities that we're supposed to eat them. I think we're eating too much. I mean, the whole vegan paradigm, the vegan craze went out, and people were cutting out meat and promoting veganism. Food supply is very plentiful. You know, our ancestors probably didn't eat the quantity, and they were probably fasting a lot.
Good point.
You
Yeah.
know, so we're
Yeah.
have more availability. Then we're going to these plant-based foods, like these, you know, alternative milk products, the almond milk, and, you know, these almond, as we go gluten-free, we're also going high oxalate. So it's kind of, we're
Right.
exchanging one evil for another.
Right. Yeah, that's a good point. And so what is oxalate dumping and its impact on, you know, like for, you know, you talked about one of the impacts it has is on the immune system. So just the term, what's oxalate dumping all about?
Well, the theory is that when you, your body stores oxalate in tissue. And so obviously your body wants to maintain homeostasis. And so if you're consuming a certain amount of oxalates that's pretty consistent, your body's, yeah, it's going to store it, but it's not having this signal that it needs to release what it's stored. And so my understanding is that when you drop your oxalate intake too drastically, too quickly, I've done it, I've been there, I know what it's like. There's a honeymoon period of about 3 to 5 days. Some people have it about a week where you're like, oh, wow, I feel really good. And then now your body's like, oh, wait, no oxalate's coming in. That means we can start to, because it's a toxin, right? So we can start to excrete this out. And unfortunately, when that happens, your symptoms actually return, and they could be worsening. There could be new symptoms that pop up. In my case, bleeding, a lot of bleeding from my urethra, because these crystals had to pass out of my urinary tract. So I have experienced a lot of bleeding. So whenever I have dumping, I know, because I'll have increase in urinary frequency, pain, and then bleeding.
Okay. Okay. So that said, I guess, you know, the testing of oxalates, is there testing that is helpful for clinical reasoning and clinical opinions, and ultimately for the patient to know where they're at?
From what I've seen and understand, the only really definitive way is to do a tissue biopsy,
Okay.
and probably in the liver, kidney, or I'm not sure anywhere else in the body. Urinary tests are not accurate. And that's, you know, we have them as markers on the organic acid test and the Nutri-Eval. And I'm very, I have to be honest, 50% of the time it'll show up high, 50% it'll show up not high. Because think about it, it's urine. So you have to be excreting it at the time that you collect the urine, but the body's not always excreting it. There's cycles, and we still don't know what those cycles are caused by. It could be hormonal influences. There could be a circadian rhythm tied to how it's excreted. I don't think anyone's actually sat down and studied the rhythm of oxalate excretion. We do know hormones are involved, because women will report more increase in symptoms around their cycle. So there is something with estrogen and progesterone. There could be why oxalate gets shuttled through the body. We still don't know. So that's the problem with the urinary tests. You're only doing one urine specimen in the morning when you wake up. And so you may not be excreting. And so I have to have this conversation with people, because I have to say, listen, I know the oxalates are on the test. I get it. But please don't make the false assumption of thinking because they're low that you don't have an oxalate problem, because I can tell based off of your symptoms, your health history, the digestive issues that they have. And then I can look at their hair tissue mineral analysis and tell, based on mineral status, you probably are dealing with an oxalate burden. Even with the Nutri-Eval, which is the one I rely on, that one has mitochondrial markers. So does the oat. The oat has mitochondrial markers. So with that, you can kind of deduce, hey, your mitochondrial markers are off, or your vitamin and minerals are off. Mm-hmm. Your diet is high in oxalates. You've got gut dysfunction. You've got, you know, leaky gut. This biosis, you have an oxalate problem.
Right. Yeah, you put the whole clinical picture together, and yeah, maybe you might be missing like you said, an excretion moment, but the total picture says we need to look at your oxalates.
There are tests for blood oxalates I meant to mention, but Arup Labs has a blood oxalate. It's a very difficult test to obtain. When I called them, they said I have to do it in a hospital setting. And that was another one that when I spoke to Sally Norton, she had mentioned to me that one wasn't accurate either. So the biopsy is really the only way. And that's too invasive for most people. So.
Okay. So we've kind of talked a little bit about, you know, what the oxalates are and where they're found and the impacts that it has. What are some of the positive steps to deal with that? The one would be, hey, if I'm too high in oxalates and I've got some oxalate issues that you're, again, seeing clinically, or if you just want to, you don't have any issues that you're aware of and you just want to be using oxalates in a positive way or in a, judicious way, what's the lifestyle approach for managing oxalates well?
It does vary person to person. That's what makes it a little bit tricky. It just depends on various things. For example, their genetics, their gut health, nutrient status. But I do have a 6-step process that I can go through. I think it's 6 or 7
Yeah.
steps. The first thing is obviously, and this is what everyone does when they come to my clinic. Number 1, fix your gut bacteria and dysbiosis. You will be surprised how many people walking around this planet have dysbiosis, and they have yeast overgrowth, they have mold overgrowth, they have no lactobacillus whatsoever in their gut. That was me. Unfortunately, the antibiotics are probably responsible for that one. Reduce your intake of pesticide containing foods that way, because that's going to disrupt your microbiome. Take certain probiotics that we recommend. I like the Bacillus subtilis is what I like to start people on. It's just a very, very gentle, yet it's not, you're not trying to seed the gut, you're trying to make the gut more hospitable so that you can start to promote it with diet. So diet is one way to promote good bacteria. And then if you have mold, you probably need to find out if you do. That's what run the tests and then treat that. So that's the first step. And that leads to the second step. If you find mold and yeast, you're going to have to treat that. I don't always recommend people to do that right off the bat, because oftentimes when you kill bugs in the body, like, especially yeast, there's a die-off reaction. But I have found that when they have that die-off reaction, that can throw them off the cliff. So what I like to do is go into the next step. So we'll kind of put that on hold. All right, you have mold yeast. Let's put that on hold. Let's go to the next step. Let's go ahead and work on medical nutrition therapy.
Okay.
That could be digestive enzymes. That could be the probiotics. That could be repleting minerals and vitamins that you have been depleted in because of, for whatever reason, poor diet or the processes that your body's going through. Another thing that's really helpful for a lot of people is reintroducing sulfur back in through Epsom salt baths or MSM powder or high sulfur foods.
Okay. What does the sulfur do? I was wanting to hit on that.
It competes with oxalate.
Okay.
So it does help lower your oxalate burden that's inside the body.
So yeah, so it's competing with the oxalate. It's not necessarily binding and detoxing it and taking it out. It's just competing with the oxalate. Okay.
But that brings in the other thing with binding it, increase your calcium containing foods. So many people are not eating a lot of calcium. Think about it. We're going through this dairy-free, as people try to get healthy by doing elimination diets, they're also cutting out dairy and foods that may have calcium in it. Calcium needs are actually quite high. For a woman, it's about 1,000 milligrams, you know what I mean? So you have to make sure you're getting enough calcium. So one of the things you can do is eat calcium, and you can take calcium supplementation, or you can just drink, a cup of flax milk has 300 to 400 milligrams of calcium in it. So
nice.
Yeah. And then the next space, a lot of people don't also know this one. We're eating too much fat in our diet. High fat diet should be avoided. I try to tell people to stay around 30 to 50 grams of fat a day. The main reason for that is because excessive fat will bind up calcium and make it unavailable to neutralize the oxalic acid. The main reason for that is because most people have gut dysfunction, don't have enough of the enzyme secretion like lipase to break the fat down. So then the fat actually creates these little soaps inside the gut. And as a result of that, the oxalic acid or the oxalate can passively absorb more readily through the GI tract. The other thing is a lot of people don't have a gallbladder, or they have gallbladder dysfunction. So they've got bile issues, bile dysfunction or deficiency. And that alone is going to, bile is a emulsifying agent for fats. And so if you don't have enough of that, then you're going to have, again, these soaps. And then you can do things, herbally, like lipotrophic factors and chloretics and cholagogues, like, milk thistle, horseradish, ginger, licorice. Certain vitamins and minerals can help you with improving your absorption of fat. But one of the best things to do is to don't eat, like a lot of these keto diet eaters, they're eating way too much fat.
Okay. Yeah. So they have to definitely weigh out their overall nutrition approach.
Yep. And the last step is decrease oxidative stress.
Okay.
Whether, and you have to find the source of oxidative stress. Some of that could be increasing antioxidant containing foods,
Okay.
nutrients that promote your antioxidant pathways, like superoxide dismutase. There's also sulforaphane can be a good one. There's glutathione, and just optimizing those pathways. And then again, goes back to, if you have mold, you have dysbiosis, you're going to have more oxidative stress. And the reason I bring up the oxidative stress is because the oxidative stress upregulates the glyoxylate pathway that leads to increased endogenous oxalate production. I just want to repeat that so people understand this is another mechanism that COVID has caused increase in oxalates in a lot of people who never had an oxalate problem, because I've seen this personally in clinic. Oxidative stress can upregulate glyoxylate pathway to convert to oxalate. And if you have oxidative stress because of a virus, because of an infection, because of mold, because of chemical toxicity, you indirectly are producing oxalates as part of your own metabolism.
So hitting the mold a little bit further. So we're not just talking about food molds, we're talking about even molds you would find in your home. And it's my understanding Aspergillus is one of the main concerns when it comes to mold. Is that
That's
accurate?
the most common, but I've
Okay.
seen gliotoxin, and there's others. There's so many species. There's two labs that I use, Great Plains Lab and Vibrant Wellness.
Okay.
They have different markers on their panel. I will say that the Aspergillus is the biggest culprit, and that's the one I was afflicted with as well. They have other mechanisms in the body besides oxalates. They can really damage your body. They're very, very, I mean, they're a poison.
Mold toxins. Yeah.
Correct.
Yeah, absolutely. And is it something that one should consider, obviously, there's different tests that people can do for what's going on in the chemistry of their body, but how about in the structures of their home? Are we talking, hey, is that another step that you've kind of had to walk with your patients on, or?
I had to help, first of all, there's a lot of coaching involved in my job. I have to first encourage them to take that step, because unfortunately, that is probably the hardest thing for all of them to do, because that's your home. That's, where you reside every day. It is unfortunately a can of worms once you open it, because what happens is they'll find it here and then they'll find it there. And now the whole remediation process of it can be very difficult. I relay on the experts to guide them on what the best thing to do. But if you're listening to this and you have a brand new house, you probably don't have mold, but you should be putting in some really good air filters while you can, because you can prevent, you can really prevent that from becoming a problem. I think the biggest problem is water damage in the home. When water damage occurs in a house, it needs to be remediated immediately and needs to be correctly. And if you can get on it right away, you'll have less of a problem, because most of the issue I've seen with people who have basements and they have crawl spaces, and that's where they're being found.
Okay.
Yeah.
A lot of the crawl space. Yeah.
Mostly it's crawl spaces and basements. Although there have been people who have an older home where they've had water damage in a bathroom, and they might see, when it's behind the walls. So you won't know it's there. Often you won't know it's there, but when people have gone as far as torn the walls down to see where the mold was, they'll find it in behind the walls in an area that there's been water damage or leaks.
Okay. So the mold part is definitely a big part of it. You talked a little bit about, to try to bind oxalates, the calcium. How about things, I don't know, I know I've seen a little bit on activated charcoal might be helpful.
Yes.
And then I was curious about diatomaceous earth, if it might have an impact on binding oxalates or not.
I'm not sure about that one.
Okay.
Yeah, I'm not sure about that, but I know the charcoal for sure is a good one. They also recommend that for people who've been glutened.
Okay.
Yeah, I've done that before. But again, it shouldn't be used as a crutch, because I think what happens when people hear this, they might say, "Oh, I can go have oxalates. I'll just take charcoal."
That's a good point.
Yeah.
One of the things
Don't do that.
One of the things I'm thinking about when I ask that question in preparation for having a conversation with you is, it sounds like using our show name here, it's not a quick fix. When you start to try to detox the body from oxalates, like you said, it gets stored and then it'll start dumping. And we're not talking about, hey, let's add more oxalates in, But my understanding from what I'm hearing and is that it can take a long time for your body to really get rid of oxalates. And so that's why I was wondering about, activated charcoal and or those types of things just in general as a prophylactic, if nothing else, but maybe as, hey, you're going to need to do this for quite a long time to really get rid of whatever oxalate reality you have. Is that?
Yeah, but the binders are going to help with other things as well. I mean, we're
Sure.
exposed to other things that disrupt our immune system anyway, such as heavy metals, pesticides. And honestly, I have told people that binders, you should view binders as going to the dentist. You go to the dentist twice a year. It's your insurance policy there for your teeth. Well, binders are kind of the same thing. And let's take
I
this
like
another
that.
step further. I actually encourage people to consider doing a full-blown detoxification diet, even for 5 days
Mm-hmm.
every month, once a month,
Okay.
every other month. So, I mean, there's things people just don't do because they're not told to. We're told to go to the dentist, but no one really tells you that you should take binders. Nobody really tells you that you should, you know, clean out your gut or fast or, stop eating for a few days. I mean, these are all little things you can do because it is the small things you do that accumulate over time.
Mm-hmm.
There's, like you said, there's
Right.
no quick fix. It's a lifestyle. It's a lifestyle.
Right. Absolutely. So, anything else on oxalates that we haven't quite hit?
Yeah, I think that if you're not sure if you have this particular problem or this mechanism that's going on that might be contributing to your issue, the first things you can do is to look at your diet. I think a lot of times just bringing awareness when people don't even realize, are you eating appropriately for your microbiome, and could you be, you know, loading up. I mean, even regular people who don't have any other issues can really have problems with this. You don't have to have IC or an autoimmune condition. You can just be a healthy person and maybe just consuming too many oxalates in your diet. So that's the first thing. And there are, solutions and ways to investigate. Um, One thing we didn't touch on is genetics. I do think that
Okay.
does play a role. That does play a role in this. There are different types of gene pathways. Um, um, Generally, when we think about genetics, we're thinking about kidney stones. And so there are some people who may have different variations of some of those different enzymes that might lead to type 1 and type 1 hyperoxaluria, which tends to be more of the endogenous type of that. So, there are tests out there that you can identify, because if you are a person who has a variation of those genetic pathways, I had one of them, then your oxalate quota in the diet might be tighter as opposed to somebody who doesn't have the pathway. Maybe I've seen it where people were just pounding down too many oxalates. They didn't have any of the other risk factors, maybe a little bit of gut health issues. But once we got them on a lower oxalate diet, they felt better. I'm going to be honest, when I did the low oxalate diet, I didn't feel better. It wasn't enough for me. I have the genetics and I had the mold overgrowth.
Okay.
It's very variable.
Yeah. 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 So, yeah. So definitely you really kind of want to look at your lifestyle. You want to look at your genetics. All of those are factors. And we've covered quite a few of the epigenetic influencers, the environment itself. And so, good. Well, and so what would be two good solid take home tips, just in a summary way of, you've kind of covered a lot here. What are two kind of the highlights? And there's
Plant-based
many to
foods,
pick from.
I guess this is going to be hard for me to say because I think it's going to probably make some waves. Plant-based foods are not evil.
Right?
That's one thing that I'm finding is driving me crazy, is how we're taking the pendulum and we're swinging it the other way. They're not evil. We as humans were born with mechanisms to eat a variety of foods. We have a digestive system and we're not that different amongst each of us. I mean, we have
Right.
individualities for sure, but we're not that much different. And so when people are, demonizing certain foods, I can't support that. I believe that everything is fluid and dynamic and your body can change. So maybe today you might be really, really, really sensitive to a certain diet, but with various interventions, you can find in a year, 2 years, 3 years that you can actually reintroduce certain foods back into your diet. I have. I really have. I'm not saying that oxalates are positive, because I know that was one of the questions, can you view oxalates? I don't think the oxalates per se are positive. We know that they're a poison. I think the plant-based foods that contain the oxalates have positive characteristics, that hormesis, because of the phytonutrients, right? So small doses have beneficial impacts in the body, but when we go to do too much of it, then it can be harmful. I do believe plant-based foods are in that hermetic category. I think that you have to have some of them, because you have phytonutrients that are involved in cell-to-cell communication for your health and your immune system and your antioxidant pathways and so many other things. So you can't just demonize this. And I want to make sure that's clear here, because I don't want anyone listening to think that I'm demonizing plant-based foods. I'm not.
Sure. And before you go to the next one, I throw in a couple comments, because as I'm studying more and more, I'm still studying. I've been studying for a lot of years. I plan to study as long as I can. That is one of the frustrations I have too, is, I believe the plants are here for our good. You've made some good points. Like, we might not have been eating, a whole smoothie full of spinach 200 years ago, and those kinds of things. And so while the plants have their own protective mechanisms, I think that's part of the design for the plants to be able to be available to animals and humans,
That's right. If they weren't, we'd all die off, wouldn't we?
Right. And so I'm with you. It's one of the things I think that people do have some challenges, especially when we consider what's gone on with all the chemical and environmental exposures that we've talked about, that has weakened our ability to do well in processing some foods that might be harder on us, not because the plant's bad. And now in many ways the plants are bad because of the pesticides, the herbicides, and all the different things that have gone on. But so I'm with you. I like that you're pointing that distinction out, that, it's not to say that plants are bad or any of these things are bad, but we need to just know the game we're in, I think, is one way of saying it.
Yeah. And, honestly, at the end of the day, let's go back to the microbiome, because really, if you were to compare our microbiome now versus, just don't go too far, go to some places in Africa when they do the microbiome comparisons, and diversity is really low here. We don't have a very good diverse microbiome. What's one of the ways to increase diversity of the microbiome? It's with fiber and plants, not with meat.
Right.
Meat is going to start that proteolytic. And if you research proteolytic fermentation, there's a whole lot of diseases associated with that. You want to promote saccharolytic fermentation. And the only way to do that is with fiber in the diet and a diversity of fiber. We're talking about multiple different types of species of food, which is why I promote the rainbow diet. When I talk to people, it's all about the rainbow diet. It is a very difficult conversation to have in the same context of low oxalate. It confuses people, and it does take a very, very step-by-step strategy in trying to let people understand that you can still be low oxalate and still do the plant-based, not plant-based, but a high plant microbiome favorable diet. If there is a way to do that, you can do it. And I think what happens is when people hear plants, they hear oxalates, all of a sudden they're like, let's go that way and just eat meat. And that's all we eat. And I'm not here to promote that whatsoever.
Right. And the same thing I think is, important to say with the animal-based approach. Not all animal-based proteins are equal in their quality and their benefits to the human. So I like, when I talk to my patients, I tell them I think there's a lot of great elements in all of these approaches to health, especially when they're naturally based, whether it's a little bit of the keto, a little bit of the paleo, a little bit of the vegan or vegetarianism, all of those things, have very good elements. And at the end of the day, you want the quality and you want the ratio that really works well for your body. And sometimes you need a coach, and sometimes you need some help to be able to get down that road, especially when you might be coming to the conversation after your body's just been beat up for 40 years or 50 years, So that was good. Plant-based is a really good take home. Is there another take home before we finalize our current conversation?
Move around, sweat, and get some sunlight. Spend time with nature. Breathe some oxygen. I think when you think about it, and let's just zoom out, because I think we're zooming in, but let's just zoom out and look at everything for a second. You know, we are a product of nature, and we should be spending time in nature. And so with that, there's just things we're not doing anymore. We're not spending time in the sun. We're not breathing oxygen outside, and we're not sweating. We should be sweating. When I ask my patients, do you exercise to sweat? Many of them say no. If you can do these things that we're talking about, and like you said, eat foods that you had to either grow or kill, you know, right? And you just 80-20 rule. 80-20 rule is how I like to live my life, because I can't do 100 and commit to that. But if you can stick to that and do the 80-20 rule, it all kind of falls in place. It's not that complicated.
Yeah. That's awesome. So how does one follow up with you, Mandy, Dr. Mandy?
I have a website, ichealer.com. I'm very active on Instagram, so you can check me out on Dr. Mandy DCN. I'm also on TikTok, not as active, but I'm also Dr. Mandy DCN over there. And I have a YouTube, IC Healer. And you can email me at mandy@ichealer.com as well.
Awesome. Well, boy, it's a pleasure to have you again. I think we're gonna have to maybe make this a yearly September event.
Love that.
And we'll follow up and see where things are at next time. So thank you for joining us today.
Thank you for having me.
You bet. Okay, everybody, have a great day, and find the best plant-based options for your best health.